We are very pleased to welcome you all. We have representation from 47 nationalities here. For those of you who are new to the GFBR, just a reminder of the ethos and what we seek to do with this two-day meeting. We're bringing researchers, research policymakers, ethicists, among others, together to share experiences, to promote collaboration, specifically around research ethics, but obviously other topics will come to the fore. The forum prioritizes the participation of colleagues from low and middle income countries. We encourage networking and mentoring, and we hope we're creating a venue for open and inclusive discussion. So we actively welcome everybody's participation. That's the way that we have structured these 2 days of discussions. You'll note that part of the uniqueness of this meeting lies in its size. We're trying to cap it, although the room we could probably have double, but we're trying to keep the numbers under 100 to keep that community ethos. But also we want to explore in-depth topics, which is why we have the case study format and the breakout groups where we invite everyone to participate. I want to alert you to a few things. Additionally, we have a fortunate to be continuing the fellowship scheme. So colleagues who are interested in following up on issues raised at this meeting can apply for a fellowship. The grant scheme has been running now for a number of years, and the latest round of the scheme will launch tomorrow. You'll get an email with the details, but just put the deadline of the 1st of March into your calendar now. The scheme is open to participants from low and middle income countries, and it has a maximum of award of $10,000. You can do a lot with that, trust us. And you'll be able to find out more tomorrow once we launch by visiting the website. Just something on the format for the next 2 days. There are 5 thematic plenary sessions, each of which is, as I've said, followed by small group discussion. You've all been pre-allocated to a group, and you'll find the group number on your name badge. It's this little thing down here. If you're lucky enough, I'm in group 8. I think 8 groups, Adrian? Perfect. And so you know the logistics, where to go. Groups, let me see if I can get this right. Groups 1 to 6 will meet in this room, and groups 7 to 8 will meet in the Labadi suites. Follow me, because I know where that is. And I think for those who are in the Adaptive Platform Trials meeting, that's the same room. So follow anyone that looks like they know where they're going for groups 7 and 8. We will meet at the back of the room for that breakout group. You'll stay in the same group over the duration of the 2 days and have the opportunity to discuss the issues raised in the papers. The groups will be facilitated by members of the GFBR Planning Committee, wave your hands, and Steering Committee, wave your hands. Those people will be facilitating. This event is filmed, and a photographer will be here tomorrow to take our group photo. There is a conference dinner. I'm very pleased to say it's on the beach. I think that's a first. We've been able to say we've got a conference dinner on the beach just out there. And Adrian's told me to say appropriate footwear is advised. Toilets are out the end over there, just across the little walkway. We also have a best presentation prize. So at the end of the 2 days, we'll give an award for the best thematic plenary presentation and best Pecha presentation. You'll be asked to vote for your favorites towards the end of tomorrow's meeting. So please just keep a note on that when listening and bear that in mind. There are many thank yous, and obviously we'll do a lot of them at the end of the meeting, but I really do want to extend my thanks to the Planning Committee. They've put a lot of work into this, to the Steering Committee, and to the GFBR funders for their continuing support. We would not be here without them. So that's the Wellcome Trust, the US National Institutes of Health, the South African MRC, and the UK MRC. So a huge thanks to them, but also to our local hosts, particularly my colleagues from the WHO Ghana Country Office, who've been invaluable in helping us, and the University of Ghana And of course, a special mention to Paulina and Caesar as literally the local hosts who've been helping us with everything. So that's it from me. Without further ado, I really want to introduce the representative from WHO who's coming here to welcome us personally. So my pleasure to welcome Asrat Sofonias, who's the officer in charge of the Ghanaian country office. Thank you.
Thank you very much, Katherine. Distinguished guests, ladies and gentlemen, all protocols observed, good morning. On behalf of the World Health Organization, it's my great honor and privilege to welcome you to Accra for the 2025 Global Forum for Bioethics Research. The WHO Country Office and the entire WHO family is pleased to host this distinguished gathering of experts and partners from more than 47 countries who have traveled here to engaging in this timely and important dialogue. The theme of this year's forum, Reimagining Research Partnership, Equity, Power, and Resilience, invites us to reflect deeply on how global health research is designed and conducted in a rapidly evolving world. It challenges us to look beyond traditional models, to examine the power dynamics that shape collaborations, and to re-envision partnerships that are ethically grounded, inclusive, and mutually empowering. Ghana is indeed honored to host this global conversation. Ghana has a strong and growing legacy of health research leadership and ethical oversights. And institutions such as the Ghana Health Service Ethics Review Committee and the university-based review boards ensure that research conducted here is held in highest standards and that the rights and dignity of participants are consistently upheld. Ghana's contributions to global health research are broad and impactful, from maternal and child health and non-communicable diseases to infectious disease control and pandemic preparedness. Ghana was among the first 3 countries globally to introduce malaria vaccine, supported by the pioneering trials at the Noguchi Memorial Institute of Medical Research with WHO's technical collaboration. We continue to contribute to multi-country genomic sequencing studies and antimicrobial resistance surveillance, strengthening both national and regional health security. Allow me also to highlight that advancing equity is central priority for WHO Ghana. Working with the Ghana Health Services and the Ghana Statistical Services, WHO supported development of Inequality in Health Ghana report using the Health Equity Assessment Tool and secondary analysis of studies like the Demographic and Health Survey. WHO has similarly supported a national geospatial accessibility analysis using a tool called Access Mode, mapping travel times to health facilities and identified underserved populations, and thereby addressing the issue of equity. Ladies and gentlemen, the idea of resilience of systems, institutions, and partnership is central to this year's discussions. The COVID-19 pandemic reminded us of the equitable collaboration and ethical preparedness are essential for effective emergency response. Strengthening research capacity and ethical review systems before emergencies occur is not only prudent, but is a matter of justice. The World Health Organization remains fully committed to advancing ethical and equitable research. WHO will continue to strengthen national research capacity, support laboratory systems, facilitate knowledge translation, expand international collaboration, and promote equitable access to innovation, including genomics, antimicrobial resistance work, and vaccine development. Let me commend the World Health Ethics and Governance Unit for its leadership and extend sincere appreciation to the GFBR Steering Committee, Planning Committee, Secretariat, and the University of Ghana and the WHO Country Office for the exceptional work undertaking in organizing this forum. We also acknowledge the invaluable support of the Wellcome Trust, the UK Medical Research Council, the US National Institutes of Health, and South Africa Medical Research Council. Once again, welcome to Ghana, the land of warmth, resilience, and opportunity. May your time here be enriching and inspiring. Thank you and all the best. Thank you very much.
Thank you, Dr. Sofonias, for the warm welcome. It's my great pleasure to now introduce Dr. Paulina Tindana, my friend and colleague from the University of Ghana.
Great. Thank you very much, Katherine, and good morning, everyone, and welcome. Obake, Akwaba, Maraba, Wezo. So you'll be hearing some of these welcome addresses as you go through the day and the days to come. On behalf of the Planning Committee, I'd like to welcome all of you to Ghana, and particularly to the Labadi Beach Hotel for this Global Health Forum, which is co-hosted by the University of Ghana and the WHO Country Office. We are really excited to welcome participants from over 47 countries, from the USA, France, Argentina, Bangladesh, several other countries. We are really very excited to welcome you to Ghana. Hosting this forum is also very special to us at the University of Ghana because one of the first research ethics committees that was established by the University of Ghana, the Noguchi Memorial Institute Institutional Review Board, was established 25 years ago, in November, 25 years ago. So we are really excited that this is an opportunity for us to also highlight some of the work that ethics committees are playing. And so we really look forward to some of you joining us on campus on Thursday, where we have an interaction between our students and faculty, and then the steering committee. So once again, welcome, and it's really my pleasure to introduce the Pro-Vice Chancellor of the University of Ghana. In fact, if I have to read his bio, it's a whole thesis. It's a whole thesis, but I'll try and summarize it. So our special guest of honor is the Pro-Vice Chancellor for Academic and Student Affairs, and also the founding director of the West African Center for Cell Biology and Infectious Pathogens at the University of Ghana. Just last week, he was awarded the Baylor K. Ashford Medal in recognition of his outstanding leadership and contributions to global health research. So I think he's the best person, to give the opening remarks this morning. I'm really excited to have him. So Professor Awandare is also a professor of biochemistry, cell and molecular biology, and also leads the University of Ghana Collaborative on Climate Resilience and Sustainability Initiative, which brings together researchers from diverse disciplines to develop innovative, evidence-based solutions to address climate and sustainability challenges. Through his visionary leadership, his organization, WACBIB, has become a model of excellence in biomedical research, training, and producing a new generation of African scientists making substantial contributions to global health. So, ladies and gentlemen, please help me to welcome Professor Gordon Awandare.
Thank you. Thank you very much, Paulina. Thank you. Thank you very much to all of you for taking the time to join us for this forum. The University of Ghana is incredibly honored to be co-hosting this very prestigious forum. We are also very delighted to be partnering with the WHO, with whom we've had a very long and sustained partnership, both at the local level and at the the international level. I think that Mr. Sofonias already highlighted some of the work that the university does in collaboration with WHO in terms of genomic surveillance and many, many other initiatives that support healthcare delivery in the country. Distinguished guests, the University of Ghana truly values the role of partnerships in research. Indeed, one of the 5 key strategic priorities of the University of Ghana for the next 5 years is to strengthen our engagements and partnerships. And so the theme of this year's forum is very much in line with the vision of the university for the next 5 years. And we are very, very delighted that you've chosen to have this meeting here with us and to engage our faculty and our students in your discussions. Indeed, at this time of the global research funding landscape, partnerships have become even more crucial to the promotion of research. I believe that partnerships that are sustainable are those that are equitable, are those that are balanced, are those that are mutually beneficial, and are those that recognize the strengths and contributions of each individual unit of the partnership. And so we truly look forward to the product from these deliberations. We are looking to you as experts in this arena to provide guidance to the community on how we can continue to build sustainable, resilient partnerships that can strengthen research and provide the framework to, let's say, weather the current storms in the global funding landscape. Where resources are limited, partnerships are the best vehicle to optimally apply those resources. And we believe that this forum would provide the necessary recommendations that would guide all of us over the next few years as we navigate the turbulence. I want to thank my colleagues from the University of Ghana, Professor Paulina Tindana and Cesar Turi, for the outstanding work they've been doing in not only organizing this conference, but generally being leaders in the bioethics arena over many, many years, both locally and globally. And we are very proud of what they've done and the credibility with which they've promoted the work of the University of Ghana on the global stage. The University of Ghana has a very strong research portfolio in health, and this is, it's across disciplines, from the basic sciences where I come from, to all the way to the humanities and social sciences where Cesar and others operate. And the strength of our university is having such a multidisciplinary faculty, which allows us to collaborate and to conduct innovative research, leveraging on the strengths of the entire breadth of our faculty. So, ladies and gentlemen, on behalf of the management of the University of Ghana, I warmly welcome you to Accra. I warmly welcome you to Ghana's premier university, the University of Ghana. And I hope that you enjoy your stay close to the beach, but also make some time to visit our beautiful campus, where you would find, a vibrant community of young people who are very keen to learn about bioethics, to learn about research in general, and to learn about partnerships. I thank you, and I wish you a very successful forum this year. Thank you.